Us now, Secretary Kennedy. Secretary, thank you for joining us. Appreciate it. Good to see you.
Hey, Chris. Good to see you. Thanks for having me back.
So what are you doing, and why should we care?
Well, you know, during the transition, just before I got confirmed by the Senate, one of my deputies called David Cutler, Dr. David Cutler, who is an economist at Harvard, who's been studying the American healthcare system for 30 years, and said, what's the one thing that we could do that would dramatically change healthcare delivery for the American people? And he didn't wait a second. He said, get rid of prior authorizations. Prior authorization is the authorization that your doctor, when you're sitting in the office with your doctor and he prescribes you a drug or an intervention or a device, and then you have to wait maybe for hours, maybe for days, maybe for weeks to figure out whether or not your insurance company is going to cover it. 85% of American patients say that they've experienced medical delays because of prior authorization. What we did is we brought all the major insurance companies in this country together, about 12 of them, who covered 271 million Americans, and we asked them to make an agreement to get rid of prior authorization for most interventions, for 85% of interventions. Some of them you want them for. Most of them you don't, and they've been very, very badly abused. Typically, a doctor in this country spends 12 hours a week filling out forms for prior interventions. There's no interoperability of this system, so each insurance company has a different methodology. Some of them require you to reply by fax, some of them by phone, others by a computer portal, and if you do it wrong, you don't get it. So millions of Americans get denied. As you know, there's been violence in the streets directly as a result of these complaints. And this is a milestone in American health. All of these insurance companies have now gotten together and said, we're going to make our systems interoperable. We are going to we're going to facilitate speed. We're going to answer in seconds or minutes. And for 85% of the drugs or interventions or surgeries, we're going to abandon prior authorization. You get it automatically. Let me give you one example. One of my best friends is a surgeon in New York, and he's a heart transplant surgeon. He recently had a patient who was dying and needed a heart transplant. He had him on the operation table. The insurance company had approved prior authorization for the transplant, but they refused to approve, and they found out this just before surgery, they refused to approve the electric pump that is needed to keep the patient alive between when they lose their old heart and they get their new heart. The doctor was faced with a dilemma. Do I do this and not get the surgery paid for? And they went ahead and they did the surgery. He then got sued by the insurance companies. So that is the problem that every doctor in this country faces, and this is going to change that so that that never happens again.
So I love it until those last few words. Never happens again. I don't trust them. This is voluntary. And how do we know that the 85% that they cut out leaves the 15% where they do it most often and it causes the most inconvenience? How do you make them do it, and how do you make sure that they're not screwing you?
We have agreed on a list of the interventions that they won't require prior authorization for. There are certain
and if you catch them doing it, what can you do to them?
If they don't comply, we still have a gorilla in the closet, which is legislation. We have a lot of other hammers that we can bring down on them. And they have agreed to do this in the past. They did in 2022 and 2023. And they did nothing. But this time is different because the number of patients we have now covered, 271 million, and more companies are signing up every day. But also, we have specificity, we have time deadlines, we have metrics that they have to comply with, and we have regulatory sanctions if they don't do that are now before Congress. So I'm pretty, I'm cautiously confident that they're going to do it. It's trust but verify, but I think this is closer than we've ever gotten, and the agreements are very, very solid.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.